Hi, we're Roland and Alicia Brown with Black Swan Team in Remax Town and Country. Today we have Dr. Mark with MP Orthodontics, and he's here to tell us a little bit about braces and taking care of your teeth and just orthodontia in general. We've known Dr. Mark and his family, how long has it been? At least 10 years, right?
Except for you were in school.
Yeah.
You were gone.
You're gone for a little bit, but we still knew you. But their family is wonderful, and they're just a joy to know. We actually have a raving endorsement for them. Roland just got done doing his work with Dr. Mark, and I'm currently going through some treatment right now.
It's perfect.
Yeah, so tell them what your problem was.
So I was grinding my teeth like crazy. Like I was just making them shorter every single night. So he like moved it, fixed it.
Yeah, they look great. Like better than I thought his teeth looked good beforehand, but they look amazing. He did the more Invisalign type thing, whereas I went with traditional braces because I actually had to have jaw surgery and do the whole shebang. So hopefully I'll be done almost here soon. But we just rave about Dr. Mark enough, and he's been wonderful to work with, and he's incredibly talented, and his whole staff is amazing. But so we just wanted to hand it over to Dr. Mark and tell us a little bit about what services you offer. And I know we already kind of told a little bit about what we had done, but what do you kind of do?
Well, thank you. Yeah. Well, I am a board certified orthodontist, so I specialize in orthodontics. That I'm still a dentist, but I don't do the cleanings, fillings, crowns, that kind of stuff anymore. My practice is limited to orthodontics and dental facial orthopedics, which is, the straightening and aligning of teeth, moving the jaws, jaw manipulations, which would include like TMJ, joint problems, stuff like that. As far as like options, I mean, we do it all. Metal braces, clear braces, aligners, braces on the inside of your teeth. We try to just go through all the options and explain pros and cons of each and help you decide which one's gonna best meet your needs and fit in with your lifestyle goals. But yeah, so yeah, you guys chose different paths.
Yes, we did.
What you guys wanted to get and what goals you wanted to accomplish.
Yeah.
And each one has its own little sets of pros and cons.
So why would you like, do you have a reason why you would tell someone to go one path or another?
Mostly depends on their goals, and what they want to do. Like, I mean, if you want bone movements, like different facial structure, I mean, that's probably going to involve jaw surgery, and at least more traditionally, although now a lot of surgeons are, including Dr. Sherry, who's great, give him a shout out.
He's great.
Can do some of the jaw surgeries with aligners. In the past, that's been a hard stop.
Really?
Now they've developed a lot more like bone anchors that they can put in before the surgery to help, tie things down and hold things in position while they're doing the surgery.
And the aligners, that's actually the plastic thing that Invisalign is the big company, but aligner is what it actually is called.
Yeah, it is an aligner, but yeah, Invisalign's, it's kind of like the name brand, like the Tylenol of acetaminophen. It's your clear aligners to straighten teeth, and they're great. Aligners struggle with some big movements. Not that they can't do it, but harder movements require a higher degree of compliance. And if the patient doesn't think that they can comply, if they have some of those harder movements and they don't think they're going to comply, well, then maybe braces would be a better option, because they're glued there. They're stuck there. They're not going anywhere. They're going to be working all the time,
Yeah, I watched these aligners and I'm like, there's no way. I would not have had the ability to like stick it in, pull it out, like do what I needed to. Yeah, no. So braces.
Yeah, it takes like a certain level of discipline. Like in the beginning, everybody's good, but as time wears on, breaks start getting longer and longer and longer. And then sometimes people end up skipping days. And, with the liners, if they're not in, they're not working and you're not making progress. So it worked out great for Roland. Roland flew by really fast. He did a great job.
He does do good. He was very diligent. But you do all of yours in-house, right? So if someone comes, print everything there and...
Yeah, so we have the scanners, we have all the software that it takes to move teeth, we have a 3D printer, and then we can make all the aligners in-house, which just saves a bunch of money for the patients because it is an expensive lab fee if you're using like a company like one of the main ones. But yeah, maybe let's show us office tour and I can show you around. We'll take you over to I'm in my office. We'll take so here's our front office, which we're moving things around. We're having our little COVID outbreak, so our coffee maker, refreshment stand, ice cream maker, which a lot of people really like. That's getting closed for a little while.
I love that when they come in.
I know it's always really popular with the kids. But yeah, our phone's ringing. So this is our front desk, waiting area as you walk in. We've got the chairs repositioned, spread out a little more just to allow for our social distancing, trying to keep the waiting area just as empty as possible. Bathroom. Come back into the clinic. It's all nice and open. Chairs, a little about 6.5 feet apart. So, but then we'll also be kind of even still slowing things down. Probably only running every other chair just to be able to really spread people out. This is our scanner down here on the end. It's really nice. So we're able to not really have to do any impressions. So the goopy impressions at the end of treatment or, at the beginning to send off, we can skip that. It's more accurate. It's more comfortable and, better. This is our 3D printer. So we can take those scans, clean them up, send them over to the 3D printer and print up models. We got some in here. And from all these sets of models, make all our aligners. Back here, we got our 3D X-ray machine. So everybody that comes in gets a comprehensive exam, including our 3D X-rays and scans. It just really gives us like a full picture of where everything is, its positions, what problems we might encounter. This is our consult room. So this is on your first visit. This is where we'll spend a good chunk of the time sitting and chatting, talking about options and what we can do for you, what your goals are. Did I miss anything? What?
No, I think
that's perfect. Oh, did you show the in the waiting room where the kids can play video games?
Oh yeah, we do. Unfortunately, with COVID, as we reopen, that's one of the things we had to take away. So, but yes, the waiting room, we have a Switch and some video games, toys that the kids can play at, stay entertained. But things that are difficult to sanitize, like controllers and all that, are getting cold. So,
what's the guidance that you guys have gotten for how you open and the timeline and how that goes forward?
Well, first off, like it's ever changing. Just yesterday it changed again. And they issued a lot more guidance. But things like our social distancing, everybody that comes in is, getting a pre-appointment screening call. Our waiting room is a little more spread out. Everybody's getting their temperature checked as they come in, including us. We're taking our temperature twice a day.
Yeah.
All the staff members. Anyone with, cold, flu-like symptoms stays home and quarantines. But yeah, so they've issued some temporary guidelines during this COVID period, which initially they're saying for the next 120 days, so 4 months.
Okay.
Wow.
They're wanting these additional screening questions, hand sanitizer, mouthwash.
Do you have any way to communicate via web interviews for what people's goals are and some of that initial stuff?
So yeah, we actually do. One of the, as soon as all this happened, we started looking into a lot of the virtual consult software. There's several out there. So researching them, we found some that's HIPAA compliant, which is obviously important to us, where everything gets encrypted in the transmission. So yeah, we have some software. It's on our webpage.
Okay.
You can click a virtual consult and it will text you, put your cell phone in there, it texts you a link, and it'll actually walk you through, some questions about your bite, what's important to you, what kind of things you're interested in, and then guide you in how to take a couple pictures that you can send to me. And it's all really easy. So right there on your phone, you can just click a couple buttons, snap a few pictures, and it sends it all to me. I can review it and kind of give you an idea of what costs would be, if those options are good options for you, and make some recommendations.
Okay.
Awesome. That's great.
So it's really easy, and it's great because we could use it with some of our appointments as well, like retainer checks and observation appointments, which are kind of like our growth and guidance, kids that aren't in braces, but need to be checked every so often to just kind of monitor how things are growing and developing. We could send that to them and they could take some pictures and make sure everything's still on track. So it's been helpful with patients as well.
When you're working with kids not in braces, are there things you're looking for to see if they might need braces coming up?
Yeah, because that was my next question. I know as a parent, I'm like, what should I be looking for? What should I be they might need braces? What do you recommend we watch for?
No, absolutely. I mean, and it's a little difficult to ask or to answer. I guess the recommendation is that every kid have an appointment with an orthodontist by age 7. Somewhere in that neighborhood, which I know sounds early. I mean, and my goal isn't to put 7-year-olds in braces. It's, at that point, we need an x-ray. And at that point, you can kind of see where the canines are coming in and how they're coming in. And probably most of the ones that parents that bring in their kids and, things look really bad, they need braces, often end up not. The majority of kids can wait till they're 12-ish. Right. So the point of that visit at 7 is to kind of catch some key problems before they become an issue.
Okay.
See how things are growing and developing. And there are certain things that need to be treated early and are somewhat time sensitive. Cross bites, really severe crowding and bite discrepancy. But if it's mild crowding, unless the parent and kid just really want braces, I mean, my initial recommendation is, hey, it's okay. I know it looks or may look bad right now, but I mean, my goal is to save you guys the most money, but still get a great result at the end. Right. Yeah. And, a lot of times, we can wait until, we have all the adult teeth, which is about 12 plus or minus a year, depending on the kid.
That was what I was going to ask. Is there an ideal age? So 12 is that ideal age.
So, I mean, really, it's once they have all their adult teeth, which on average, that's 12.
Yeah.
But, like I said, there are some problems that can come up, which is why we we like to see them at age 12. And, the great thing is that most orthodontists don't even charge for those visits. So, the consultation's free. All the growth and guidance visits are free, no charge. I mean, I don't even bill insurance for any of them. It's completely complimentary, just to make sure that you guys have all the information and know when the right time to consider braces is.
Yeah.
Right. Yeah, because I've heard a lot about different phases. So how do phases play into that, and what does that mean?
So yeah, I mean, you'll hear a lot about phase 1 and phase 2, or early or comprehensive, late braces, So at that 7-8 age range, phase 1 early braces generally happens between 8 and 10. If they're going to need something early. But just because you do early braces doesn't mean they're not going to need their full set of braces at age 12. So if you do a phase 1, you need to plan on most likely having to do 2 rounds of braces, because in that early round, they still have a lot of baby teeth. So it's to fix a specific problem. They have a problem that waiting to fix it could either damage the teeth or cause things to grow in a manner that's not harmonious or good. Okay, so we'd get in, we'd fix that problem, and in most cases, that treatment can be done in 9 to 12 months, and we take braces off and get done, because I don't want to burn them out or have them in braces developing cavities for a long time. We get in, we fix the problem, we get out, and we give them some retainers, and we wait until the rest of the adult teeth grow in.
Okay.
So then at 12, that's when they'd get their full set of braces.
So what's the big difference between, because we both did our work recently, so we're both adults. What's the difference between kids getting it done, adults getting it done? Like, is it turning out better when the kids are young, when adults? Like, what are you seeing in the difference between those two?
So the most ideal time is, right when they get all their adult teeth. That way, as teeth come in, we get them in a good biting relationship, develop a good bite, and things are well supported and stay. Adults, we can treat adults, and honestly, a bigger percentage of the adult population is getting braces now as a whole. Where it used to be almost exclusively kids, now we're, adults make up about 30% of the population getting braces. So it's actually quite a bit. But, as you guys know, there's both of you guys, there's a few little compromises. As an adult, we're not growing anymore, and we can't affect growth. So if our jaws aren't coming together the way they should, we have to either look for camouflage options, where we may extract some teeth to still make the teeth come together the way they should, even though the bones don't, or we talk about jaw surgery. Or like, as an adult, you may have extra wear because the teeth haven't been coming together the way they should. Since they hit funny, they wear funny, and you get just different wear facets. So most of the time, most bites, you can fix, statistically, like even as an adult, 70% of the population has what we call a class 1 bite, where the molars are in a good relationship. And, those can really be fixed at any time. It's just, as an adult, you're going to have more wear, more damage over the years.
That makes sense. I never considered those two words together, biting relationship, as a good thing.
So are there generally things that you advise as far as taking care of your braces or aligners, and what types of things you should avoid to make sure that you don't cause damage?
Yeah. I mean, the most important things to me are that they stay on and that they stay clean, right? I mean, things only work if they're on, if it's a bracket, if it stays glued to your tooth, if it's an aligner, if it's in, right? And then I don't want my patients developing cavities, or damaging the teeth throughout the process. The braces, the aligners, they don't hurt your teeth, but things that you put on your teeth, food that you leave on your teeth, if it's kept there and not cleaned off, that can damage your teeth and cause problems over time. So yeah, we talk a lot about brushing, flossing techniques. Anything will do it. A regular toothbrush, as long as you hold it and position it in all the right ways, everything, you can get it clean. I do find that electric toothbrushes do a lot better. Kids that use a Sonicare or Oral-B. I personally love Sonicare, but that's just a personal preference. Either of them will do great. Flossing, I know it's a lot more difficult with braces. They do make little floss sticks, which I really like, where they flattened one end out, so you can fit it behind your bracket and wire, and still basically floss like normal. Otherwise, it takes a lot of extra time to thread the floss underneath the wire, floss, pull it out, go on to the next one.
Yeah, I didn't last very long doing it that way. I just bought the water pick. I was like, no.
Yeah.
I'm not spending a half hour flossing my teeth.
No, and the water pick is great. It still doesn't totally replace flossing. I still recommend that you go in there with some floss afterwards, those floss picks. But the water picks are great. It's like a little pressure washer for your teeth, where you can just spray and clean everything out. I think it's great to clean around brackets and even expanders in the young kids. It works really well to spray out underneath the expander. But yeah, everybody that uses the water pick, a lot better. The gums look a lot healthier just because everything's getting sprayed out. But yeah, where everybody misses is the gum line, like underneath the bottom braces, above the top braces, especially in the front where your lips are. Your lips naturally, as you brush and come around the front, your lips want to push that toothbrush away, and then you don't end up getting the gum line. So you got to really concentrate and make sure you're getting that area. If you don't consciously do it, you miss it.
Interesting.
It's interesting.
That's good to know.
So fascinating, right?
Yeah. Well, I started like really analyzing the way I brushed my teeth.
No, I mean, that's the first thing I do. Like when I talk to kids about their brushing, I brush for like 5 minutes a day.
I'm sure you do.
What else do you do while you brush your teeth?
Still playing video games.
Yeah, because if you're picking up your room, watching TV, playing video games,
hanging out of their mouth,
anything but standing in front of the mirror brushing your teeth, you're probably just brushing the same spot over and over and over.
Like 3 teeth that are super clean.
Yeah.
That's awesome.
So yeah, it's not something that I recommend multitasking with. When you brush.
Awesome. Well, what was that?
I was just saying, get in a routine. Do it in the same order every time. That way you make sure you don't miss anything.
That's a good idea. Never thought about that. Well, awesome. Well, thank you so much for meeting with us and showing us around. And is there anything else you'd like to share before we head out?
No, thank you for having me. And come
check
it out.
Well, if anyone has any questions, feel free to reach out to Dr. Mark. His website and office phone number have been scrolling around on the bottom. But like he said, he offers free consultation, so it doesn't hurt to go check it out. And I promise you won't regret it. He's amazing at what he does. So
I met how I needed braces, and then did the free consultation. They were great, and now they're perfect.
He's always like, I can't believe how perfect they look. I didn't think they could look this nice. So,
well, thank you guys. It takes good patience too.
Yep, you got to be patient for a long time.
All right.
You weren't too bad, Roland. You were like a year.
Yeah, he's fast. He has nothing to complain about.
Yeah.
All right.
Thanks so much.
Thank you. Have a good one, guys.
You too. Bye.
Bye.